Who is Ernest Amory Codman, and who is he to us? He's the creator of the Bone Sarcoma Registry. He created the first anesthesia records, and he's one of the founding fathers of the American College of Surgeons. But there is so much more to know about the man and what he stood for. Codman was a maverick, to say the least. He was determined to convince physicians to study and document their end results. His common sense notion was to inquire, if not, why not? If not us, who? With a goal of preventing similar failures in the future. He personally did just that, documenting each of his patients for at least a year post-surgery on index cards that he called end result cards.
Codman really looked at himself first. He looked at how he practiced surgery, what the outcomes of that surgery were. He was very honest with himself, and he was very honest with those to whom he reported. His book, A Study of Hospital Efficiency, was a study about his cases. I think that the ideas that Codman came up with would eventually have come out from someone else, but Codman did it 100 years ago. Codman was ahead of his time and pushed the envelope so that many of these really became standard practice earlier than they would have been. In fact, even by the 1920s, 1930s, when Codman was still somewhat of an outcast, they were already being established in what the American College of Surgeons stood for. Most of us don't have the power, and really shouldn't have the power, to be autocratic and to force our ideas on others. It's much better, much more effective if you can, as a leader, develop consensus, if you can get the troops wanting to move with you.
Codman, however, took a different tack most of the time. Perhaps his most infamous attempt came when he presented a cartoon to his colleagues that showed an ostrich with its head in the sand, kicking up sand behind him, all the while digging up golden eggs. Codman explained that the ostrich typified surgeons and hospital administrators who had their heads in the sand, never studying their own end results, but were content as long as they produced golden eggs.
It was a slap in the face, and it was received as a slap in the face with outrage. He was forced to resign from his position. He was dropped from Harvard Medical School. I mean, the backlash from this unnecessary kind of blunt force approach led to many years in the desert for him.
Fortunately, while some remember Codman for his brash approach, his legacy has become much more linked to his contributions. The development of the Joint Commission and the Codman Center for Clinical Effectiveness at the Massachusetts General Hospital are just two examples of the influence he has had. Codman's impact on the college is equally apparent, with ACS NISQIP and the Surgeon-Specific Registry, or case log, being just two examples.
This is really going back to Codman. It's going back to saying you have to know what your own outcomes are in order to improve them. Codman said, for example, the whole point of standards is to raise them. The whole point of knowing what your outcomes are is to make them better.
By the time Codman died in 1940, he was professionally isolated and nearly destitute. He was laid to rest in an unmarked grave in his wife's family plot. In July, some 70 years later, the American College of Surgeons, the Joint Commission, and the American Hospital Association, among others, placed the long-absent headstone where they believed Codman was buried.
It was interesting that it fulfilled his prophecy that it might take 3 or 4 generations for people really to understand his ideas and appreciate them, and that's the way it's worked out.
Both Codman and ACS President-elect Andy Warshaw were what Dr. Warshaw calls Preparation H, Harvard College, Harvard Medical School, Harvard Surgical Training, Harvard faculty. And perhaps that connection is what first piqued Dr. Warshaw's interest in Codman. But as he delved deeper to learn more about the man, his fascination of and admiration for Codman only grew.
Most of us at one time or another have good ideas. We don't always have the courage to carry them through, to push them to their limit, to see them to the end. Codman certainly had that. He had too much of it in some ways, but he never gave up, even at personal cost. This is a real hero, a flawed hero, but a real hero nonetheless. I think people become surgeons because they want to be the best surgeons that they know how to be. We're all driven by doing well by our patients. Remember why you became a surgeon. Remember why you think that it's important for a patient to do well and why you want to make that happen.